Good afternoon. Thank you for joining us for the University Hospitals and Union Home Mortgage Cleveland Marathon webinar on marathon training and competing. The Union Home Mortgage Marathon weekend is set for October 23rd and 24th, and the UH Sports Medicine team is very proud to be the official medical provider of the race. My name is Liz Sellers, and I'll be your moderator for today. Before we begin, a couple housekeeping notes. In this platform, all attendees are muted. While you won't be able to ask questions through your microphone, please note the Q&A function at the bottom of your screen, and please use this function to submit questions, and I'll do my best to address all of them. Also, this webinar is being recorded and will be available for viewing on demand in the near future. It'll be posted on our website as an attendee of today's session. You'll receive an email with that link. It is now my pleasure to introduce our presenters for today. Tim Pugliese is a UH physical therapist working at T3 Performance in Avon. He is a board certified specialist in orthopedic and sports physical therapy. Tim graduated with his master's degree from Marquette University and later earned his doctorate degree through Evidence in Motion. He's completed 5 70.3 distance triathlons, 4 marathons, and is twice qualified for the USAT Age Group Nationals. He also enjoys skiing, road, gravel, and mountain biking. Dr. Laura Goldberg is a specialist in sports medicine and is board certified in sports medicine and pediatrics. She earned her medical degree from the University of Vermont Lerner College of Medicine, completed her pediatric residency at University Hospitals, and her sports medicine fellowship at the Cleveland Clinic. Her special interests include concussions, joint pain, pediatric fracture care, sports injuries, and running injuries. Dr. Goldberg was the medical director for the Cleveland Marathon for almost 10 years and brings firsthand athletic experience to her practice. The mother of 2 was a marathon runner, an Olympic level sailor, and until a 2017 leg fracture, a competitive ski racer. Sarah Horball resides on the west side of Cleveland and works full-time as an educational sales representative. She has competed in races of all distances, including 8 full marathons and 12 half marathons. Her greatest running accomplishments include finishing as the first female in the 2018 Cleveland Marathon and competing in the 2020 Olympic Marathon Trials in Atlanta, Georgia. First, thank you all for joining us and being presenters today for this webinar. As everybody can see, we have an amazing team of experts to answer all of your training and competing questions. So we're just going to go ahead and jump into it. Again, go ahead and submit your questions at the Q&A function, and we will get started. So I'm just going to start off. It's almost been about a year and a half since some people could have been racing a live race this year or in the last couple of years. Can you guys provide some insight and a bit of advice as how this might be a first live race for some and what it's like kind of jumping back into that environment?
Sarah, you want to take that one?
Yes, I can take that. So first off, if it is your first race coming back, I know we've had some over the summer and some in the spring, but this might be your first big marathon that you're training for since before the pandemic started. First off, just be kind to yourself. If things aren't clicking just yet with your training, just know it's early in the training cycle. You have a lot of time to get your body back into training mode. So just be kind, be patient with yourself. And also just a little bit of advice, look back at old training plans or race photos, or maybe you kept a journal as you trained for other races. That might help you get back into the mindset of training. I know looking back at, blog posts that I used to write and pictures and even playlists from a few years ago, when I listen to those, it takes me back to training for certain races, and it changes my mentality where I feel like I am back where I was in that training cycle and ready to go. So those are just some bits of advice. Be kind to yourself, be patient, and maybe look back at old race mementos and training plans you have.
That's some really good advice as people are starting to get back into this, to revisit this. So obviously the race has traditionally been in May, now it being in October. Dr. Goldberg, can you address the difference in the season and what runners should be paying attention to as they train during these summer months rather than training going on in the colder months in Cleveland?
Yeah, actually, I really love fall marathons because I think training in the winter and then running in a potentially hot marathon leads to a lot of just potential errors on race day because your body really uses energy differently when it's hot out, and you have different nutritional and fluid requirements. So I think, in the summer when you're training and making sure that you're not, so if you're training in hot weather and your body is going to prepare and you're going to have energy utilization and sort of more ability to adjust and to tolerate heat. And then when we get into the cold weather, you want to make sure that you are used to layering your clothes, but not, it still could be warm. I mean, it's Cleveland, it could be warm in October, but odds are it's going to be a lot cooler than what you trained in. And you may not need as much fluid. So it's always best to try and mimic the situation you're going to be in. But really, I think it's a great setup for having actually a good training cycle and a good race day.
If I can add to that, I've done the Chicago Marathon multiple times, and that's this time of year, typically in October. And people that have run Cleveland, where it's in the spring, it's going to be a little different experience. So like you mentioned, going from cold to hot versus hot to cold. What I've seen some people do is all of a sudden it's colder in October and they do wear actually too much. It's just like, the first warm day in the spring and people are out in shorts and t-shirts in 50-degree weather, and then that same temperature in the fall and they're wearing a down vest. So I just caution people not to dress too heavily. If it is a little bit colder, I mean, you can wear more layer in the morning as it's cold before the race, but then be ready to kind of shed that stuff before the race so you don't overheat too much, even though it is a little bit cooler, end up sweating more because you're wearing too much.
Mm-hmm.
Right.
Should
And
you-
sorry. I was going to add, I think they say as a rule of thumb to dress like it's 20 degrees warmer. So if it's 50 degrees race morning, then dress like it would be 70 degrees if you were just standing somewhere, how you would feel comfortable, because once you start moving, you're definitely going to warm up. Even if at the starting line, it feels a little chilly at 50 degrees, you're going to warm up really quickly.
I've seen some advice. Should you be prepared to shed clothing as you go along and wear some layers that you feel comfortable kind of setting aside throughout the route or throughout the course? Is that something that you guys would recommend to do?
I've never done it. We always tell people a layer so you can take it off. I think that following Sarah's advice usually gets you spot on. And if you train in different conditions, you really need to get used to what you would wear in that condition. And the weather can change drastically in Cleveland, but on the flip side, I think that it's nice to have layers to be able to take off, but I wouldn't layer too heavily.
I agree. Oh, sorry. You can go ahead first.
Oh, no. I was saying the garbage bag trick works too. People that in the morning will have just a garbage bag on that they can take that off before running. You don't need to start with anything extra on necessarily, just for the downtime, waiting around to line up, waiting for bathroom lines, things like that. You may want a little bit more on, but I would take it off before the race.
Right. I completely agree. Garbage bag, or just, an old t-shirt or something that you won't miss if as soon as the starting gun goes off, you toss it and go.
All right, we're going to move on. We do have some questions coming in. So we're going to move on to a question that recently came in from Brian. He's a 39-year-old diagnosed with patellar tendonitis in his right knee. Last year, he's running about 6 to 7 miles, 3 to 4 times a week. He saw a PA, went to a physical therapy. He shortened his stride and rest has helped, but every once in a while when he stands up and puts all his weight on that leg, it starts to flare up. So do you have any training, supplement, or other suggestions to deal with this injury? Dr. Goldberg or Tim?
Sure, not necessarily. I won't speak to the supplements or things like that, but whatever impairments or whatever factors that maybe the physical therapy had identified in the past that may have contributed to that tendonitis. So making sure that the soft tissue flexibility and tissue mobility in the thigh is staying nice and loose through stretching or some foam rolling, and then keeping up with some strengthening exercises. As you're going to increase the volume of running and do some longer runs, you need that muscle endurance and muscle strength. So kind of building up the tissue tolerance by incorporating some strengthening exercises will be really helpful to not just have that flare up. I'm guessing some of that symptom of standing up, having the pain might be after a longer, harder run the day before, which is really common. So again, really building up a little bit of strength through that tissue will be helpful to improve the tolerance.
The only thing that I would add to that is that, we all know that running can be painful and you can have aches and pains. But when you have a problem that is recurring, even though you've had it treated and you feel like it's quasi under control, if you're having symptoms multiple times a week, it probably is worthwhile looking and saying, all right, did I complete my therapy? Did I do everything I need to do? Do I need to look at other things that can do this? And really see if there's anything else you can do to try and get it to shut down completely, meaning the pain to shut down completely.
So that I think will lead us into just talking about some overuse and nagging injuries. What should runners do to avoid injury, but kind of fight through those aches and pains of their long runs that probably everybody has? But where's that fine line and that balance to, see somebody, get it treated, or to just kind of keep pushing through what you think your long runs need?
Well, I'll start out just by saying that in general, I already said that running can be painful. Anything that seems to be consistently asymmetric, so maybe you're always having pain on the right side, or something that is nagging, is worthwhile getting checked out. And the other thing is that for when you're, especially if it's your first time running a marathon, or if you're really increasing your training, you want to really use cross training techniques as well. So maybe if you're trying to build up your endurance, you add in some biking or some swimming or some other thing to get your cardio up, and strength training I think strength training is one of the things that runners really overlook and don't understand how much can it help in your endurance and your longevity in running.
I agree. Some people are kind of hesitant to back off from the training schedule. They feel like they have to stay very rigid to what their training plan says. But if you're having some pain that is lingering longer than 24 hours, or it doesn't go away during a run as you've warmed up and gotten into a run, then it seems to be a little bit higher stage of injury. And so you might have to actually take a few days off, back down on the mileage and stuff. And you can always catch up. And it's a long training season and leading up to it. So a few days missed of the training program aren't going to hurt you, but continue to push through and letting that issue become more significant, it was going to be, you're worse off in the long run from just pushing through that versus dealing with it early on. So it's better to get it looked at and dealt with early on.
I'll add on to say that I always feel like the longer you have something, the longer it takes to go away. I'd much rather see you and say, hey, this is what's going on. So for example, patella tendonitis, it's been going on. All right, this is tough, whatnot. You come in and say you've had it for a week, rather than you come in and say you had it for 2 years. You're going to have more luck getting rid of it early on, and you're going to return to your training earlier if you see somebody earlier.
Sarah, going along to some personal experience, if you fought through any of those nagging injuries, and Dr. Goldberg spoke about a training plan and adding some more assets into your training, especially during the year that you won the race, what was your typical training schedule look like?
So to start off, in terms of injuries, I've been pretty lucky that I haven't had anything too serious. I've had a couple issues where when it became consistent after about a week, I knew it was time to go see somebody and start doing physical therapy and back off my training a little bit so it wouldn't get worse. If that's happening, see a sports med doctor, see a physical therapist. We have two wonderful ones right here, and they will give you a lot of advice. Do your physical therapy exercises. I'm going to flat out say they aren't that fun to do, but they help. So do them if you have an injury and they have been recommended. In terms of training, yes, you're training for a marathon or a half marathon, so you're doing lots of running, but it is important to add in other types of activities too. I'm a big fan of yoga. I like going to yoga once or twice a week. It's really good for strength, also for flexibility. It's also relaxing. They play good music a lot of the time too. So I think those classes are really fun. Biking is helpful too. Go to spinning class, or if you have a road bike or a Peloton, jump on the bike. Those things are only going to help you. They are not going to hurt you. They're going to enhance your running. So I always make sure that I am adding in other activities on top of running.
Thank you. All right, so as we have a few more questions coming in here, one question from Alexandra. How do you know when you're ready for a full marathon? They've run 3 halves, but not sure if they're ready to jump into a big one quite yet. Is there a time that you know you're ready to add on the other half? Anyone can take this one.
Sure. Oh, go ahead, Sarah.
Well, what I'm going to say about that is the jump from half to full marathon, a big part of it is just running a longer long run on the weekends. So maybe you're just doing a run 4 days a week plan. Well, some of your runs are going to get a little bit longer. So it's just about building endurance throughout your training plan and making sure you're reserving more time for these runs. Because if you're running 26.2 miles, your longest long run isn't going to be 14 miles. It's going to be 20 to 22 miles. So I would say if you have the experience with half marathons, you have the mental mindset, and you think the physical endurance and ability to lengthen your training runs, then go for it. I mean, I would say if it's something that you really wanted to do, it's a goal of yours, those would be the things I would think about. I would say if you haven't done half marathons before, don't sign up for a full marathon, but because you already have run those, I would say go for it.
And I'll add on to that, if you haven't run a half marathon, you potentially could run a marathon, but you really need to have base training. You can't start running in January and sign up for your first marathon ever in September. That's a setup for injury, because your body, you gain tolerance. And so a lot of times when you do a marathon training program, if you look at the different levels, like a beginner one, a novice, whatever, to expert, they're going to change not only the mileage you run total in the week, but also the time over which you increase your mileage. So a first-time marathoner, whether you've run, for a year or 10 years, is going to be a longer program than someone who is well seasoned and has run a lot of races, because it really is about building that mindset, building your body's ability to endure the length of time it takes to train and run for a marathon. But yeah, I'm with you, Sarah. If you have the mental mindset and you want to do it, just make sure you do it properly and progressively and slowly.
Right.
The training
Exactly.
slowly.
Don't run out there the first weekend and run 20 miles. You got to build up that mileage over weeks before you hit that longest long run. And there's lots of plans out there that kind of teach you how to properly do that depending on your level and the times that you want to be able to run.
Thank you. So the next question came from Kim, and this can apply during training or obviously during the race. And you hear a lot of runners talking about hitting the wall. So can you speak to the acid build and hitting the wall halfway through, for her specifically in the upper thigh? But what's the best advice when you kind of get to that point, and whether you're in training or you're actually in the race and you feel that coming? And what does it mean to hit the wall? You hear that in marathon talk a lot. What does that actually mean?
So there's so many different directions you could go with this question. I think that one of the biggest problems when people hit the wall is that their training may have taught their body to use energy differently. So a lot of people run and train too fast, and they don't get their body to be able to use fat for energy. And really in the long runs in a marathon, you really need that fat utilization for your energy. And then the other thing that I think happens a lot is people either overeat and overdrink early on, and they get the sloshy belly and whatnot, or they don't eat enough. And then when they feel like they're tired, they're throwing in gels, they're throwing in all this stuff. And that is also a difficult thing. So I'm not answering the question well, but I am just pointing out that you got to start now looking at what you're eating, how you're eating, and how you're training your body to use energy. And then also when you're running the race, you have to take into account the weather, because if you train in cold weather and it's a hot race and you don't slow down, you're likely going to hit the wall. Vice versa, if it's hot training and cold weather, you may have issues with adjusting to the temperature as well. But it really comes down to training, I think, to prevent that bonk.
Yeah, I think it's, racing how you train. So whatever you plan to use, or even finding out what drink the marathon or with the race that you're doing is going to be providing, you want to practice with that same type of drink, that same brand, just so you get used to that. And then, use that to your training and have a plan of certain increments. Every 15 minutes, you're going to drink 4 ounces. And so, that typically the marathon, every 2 miles, there'll be an aid station. So you're going to grab, a drink and take half a cup of fluid in every couple miles. So you just want to do the exact same plan and stick to your plan on race day that you've done throughout your training. And I agree, a lot of times it's just not taking in enough, not maintaining enough fluids, or using proper nutrition, and you do just deplete your energy stores, and then you just run out of kind of fuel in your body. If it's cramping in the thigh, it could be dehydration. There's a lot of things it could be, but some of the training you can do, like we've talked about, the cross training or incorporating some strength training, so you have the muscle endurance. If it's always at that same distance that you may cramp, it's maybe you just don't have the muscle endurance for going further. So it's building a good base of endurance training, doing some cross training, and incorporating some strength and endurance training that way can be helpful also.
And also when I talk about energy utilization, you can actually get that tested. You can meet with an exercise physiologist, and they can look at your VO2 max and what your lactate threshold is and how you use energy in different ways, which can help you change your training so that you do sort of train your body for that. I think a lot of times people don't appreciate tempo runs, and they don't do as many long, slow runs to get that hours of time that you need your body working and finding that energy utilization. So really the training program that you do is going to dictate how you do in your race. So if you are training at an 8-minute pace, but you go out and the gun goes off and you're super excited and you run the first 3 miles at 7.5 or 7-minute pace, and then you kind of like, oh, I'm going too fast, I'm going to slow down. Now I'm going to go 7:45 pace. Next thing you're 6 miles in and you're still way above your pace. You're probably going to bonk. Your body isn't really trained for that. So being mindful of running the way you trained. And Sarah, you probably have a lot more advice for them.
Yeah, no, I completely
all.
agree with that. Don't get carried away at the beginning, because if you go out at a pace faster than you initially planned on, then all of a sudden you're hitting mile 10 and you're like, shoot, I don't think I can keep up with this pace. And I just wasted so much energy, and I still have 16.2 miles to go. So stick with your plan. In terms of nutrition, long runs are a great way to practice that. Waking up on Saturday or Sunday morning, eating the breakfast that you plan on eating before the race, make sure it sits well with you, make sure it's providing you with enough energy. Figuring out what gels work well for you that sit well in your stomach, or if you have the little blocks or whatever you might use for energy, and how often that you need to take those. I know I usually take gels every 6 or 7 miles. So that ends up being 3 to 4 throughout a marathon. So practice with that over the next couple of months to see what works for you. Now, the end of a marathon is going to be hard regardless. I'm going to flat out say this. I think they say that the last 10K is the true race of a marathon, and it's going to get tough. And besides physically knowing what you need to do to prepare your body and make sure that you can make it to that finish line, mental tricks really help. Running is hugely mental. I'm sure you've heard this before, read about it, heard lots of advice about it, but have tricks for yourself, like a mantra, or, tell yourself when you reach mile 22, okay, it's only 4.2 miles. I can run 4.2 miles in my sleep. Yes, I've already run 22 miles before, but you have to think about it a certain way where you're going to make it to that finish line. Or I remember when I was running the Cleveland Full in 2019, I would think to myself, okay, I just have to get to the turnaround in Rocky River. My mom is going to be there cheering. Turn around. I just have to get to West 117th and Edgewater, and some of my friends are going to be at the corner cheering. And then I have to get through the Edgewater neighborhood. Those houses are so pretty. I love looking at these houses, breaking it into chunks, manageable chunks throughout the race. So it's easy segments that you have to run. And just remember your training, remember that you have prepared yourself. So, if there's a phrase, a quote, a song lyric that really inspires you, just remember that as you're running, to just keep going when times get tough.
Thank you. That's some really great advice. We've talked a little bit about the fuel and the gels. I know you guys just mentioned some of that, but we do have 2 questions from Nicole and Catherine regarding the fuel during the marathon and long runs. Are the gels the right answer? Can you also address what food should be consumed even the week leading up to the race, the morning of the race? Is there a right answer to what people should be fueling their bodies with? Another long one, Dr. Goldberg.
Dr. Goldberg, I know you've had an opinion on the gels before, Dr. Goldberg, so I'll let you address that.
Well, it's just that your body absorbs the sugars in different ways. So you want to make sure that there's a combination of sugars. If you're just eating like the goo, sometimes that can be really hard on your stomach and it can overwhelm your stomach because it's really concentrated. And so if you're going to have a goo, you need to have some water with it. Or if you're going to have, the gel blocks, and I'm not using names, I don't know what any of them are. If you're going to use the gummies, then that's a little bit more tolerable and doesn't usually overload your stomach as much. But the key thing is really to make sure that you, number 1, train with it. Number 2, space it out appropriately, and making sure that you're doing a combination of carbohydrates with sugar as well as fluid. And you definitely don't want to be drinking fluids that are too concentrated because your body can only absorb so much. And then after that, it just kind of sloshes around and makes you feel sick. And when I say absorb, not the actual liquid, water you can absorb a lot of, but the carbohydrate within the liquid, you need to be careful about how concentrated that is. And then I feel strongly that the most important thing about training is that you eat a well-rounded diet and that you eat enough calories and enough of a balance of carbohydrates and protein to keep your body into an energy balanced situation, so that in women it's really nice that we have our periods to help us know that we're eating enough and we're getting enough energy and we're recovering enough, as long as not controlled by hormones. But it's really, really important to maintain your intake greater than what your outtake is. So if you're losing weight while you're training for a marathon, you're probably not eating enough. You need to either be maintaining weight or sometimes gaining. But it also, weight is a late sign. You can be running for several months with poor energy intake and still not be in a safe state for your body to train. You can be at a breakdown phase. So I hope that answers the question.
No, that's great. I think in addition of just, talking about diet in general, I know a lot of times people will think carbs are bad, but for athletes, if you're new to running or training, carbs are your fuel. And it is important to have, maybe at least 65% of your diet be good carbs and kind of choosing the right kind of carbs. So there's a little bit of research you can do into that, but maintaining that because you need that energy for someone else that might just be trying to lose weight and they might cut carbs and get good results losing weight. But it's very different for an athlete or someone training for an event. And the other thing is just timing for food. So if you're going to eat before a race or before a long training run, you want to eat a good 2 to 3 hours before you head out, ideally, so you have time for your body to kind of process through that food and everything, and kind of empty your stomach beforehand. So when races are early, sometimes people don't eat early enough, but you want to make sure you try to do that on race day.
Another thing too is that really making sure you get your protein in, like after you're done with a training. You have a small window, 30 minutes to 60 minutes to get that food in, so you enter recovery mode. Because when you're training or when you're racing, you're in breakdown, right? You're breaking your body down as you're doing the training, and then afterwards you need to recovery, and making sure you have a good meal before you go to bed that's not high carbs but high protein, again, for that recovery overnight.
So completely agree with everything that was just said, especially making sure you're eating enough calories. Think about it. If you're going for a 20-mile training run, you are probably burning around 2,000 calories, which is like the recommended daily amount of calories for a lot of people. And you just burned it all. So you need to make sure you're eating plenty beforehand to fuel you through that run, and also eating afterwards to make up for all the calories that you just burned. Protein, very important for repairing muscles afterwards. Maybe you're having a protein shake, an apple and a granola bar afterwards. I think that's a great post long run snack, or, go out to breakfast, get yourself some toast and an omelet and some coffee or whatnot, just to refuel your body. Thinking about long runs versus, your regular, maybe weekday runs where you're running anywhere from like 4 to 8 miles. 4 to 8 miles, you might not have to eat as much beforehand. So I'm thinking about weekday mornings, like this morning, I ran 6 miles. I got up, had a cup of coffee. I like those like Go Squeeze applesauce, strawberry applesauces, and a Kind bar. And that was plenty to get me through a 6-mile run. But on mornings where I have a long run, anywhere from like 14 to 20 miles, I will get up, I will have my coffee, I will have my bowl of oatmeal with peanut butter, banana, and honey on it. And then 2 hours later, I'll head out. I'll wait for that to digest. So you'll want to have something a little more substantial depending on how far you're running, and especially on race day. And that does mean getting up early. So if the race starts at 7 a.m., you might want to be up by 4:30 to make sure that you are done eating by 5. I'm usually up by 4:15 marathon morning. We're ready to go. And the first thing I do after, wash my face, brush my teeth and stuff, is I make my breakfast so that that is digested by the time the race starts.
Thank you. We're going to jump back into the training realm. So another question from Nicole. Her legs are feeling sore a few days after a 15-mile run. Can you substitute HIIT workouts for some shorter runs during the week, as long as you keep your heart rate up for an hour? Does that heart rate still replace the run, or do you need that endurance with your legs and the training with your legs going?
I think it's good to have a balance. It doesn't necessarily always have to be a super intense workout, but doing some cross training of different kinds is important, especially if you are very sore after a longer run. I think having a little bit of recovery time for a day or two, maybe doing some cycling or swimming or something different might be good to keep your heart rate up, but allow the legs to recover a little bit before you jump into a real high intensity like HIIT workout. That might be good later in the week as you've recovered a little bit from the long one before I do anything real intense like that. But you do get good heart rate training just from the different intervals of a HIIT workout, so it's a good thing to incorporate. But it's just a balance of kind of fitting everything in, and somewhat, I guess, trial and error. You can see how your body responds through the course of the training as far as timing your workouts throughout the week. But just not, trying to do too much overload where you're getting sore for multiple days in a row. That's, I guess, a little longer than expected.
I think it's really helpful too to have a purpose for each workout. So when you look at your training schedule, you obviously, you're going to have to make adjustments here and there, but whatever workout you're doing, you need to know what your purpose of that workout is. So if you're doing that HIIT workout just for like cardiovascular endurance, that's one thing. But if you're trying to do it for leg strengthening, then that's another thing. So really try and just have a purpose for what you're trying to get out of that workout in terms of your training.
All right, we're going to stay on training. We talked about a pace and pacing yourself throughout the marathon. So this question comes from Caitlin. She has a hard time slowing down her pace during her training runs. When she gets into the groove, she finds it hard to slow down or take walking breaks. She doesn't listen to fast-paced music, and even when listening to podcasts, she has a hard time running more slowly. Do you have any suggestions onto how to pace herself during these longer runs and to kind of find her groove a little bit easier?
Sarah?
Okay, so having a hard time going at an easy run pace is what she's having trouble doing. I'm just making sure that I'm
Yeah,
answering.
it sounds like she has a hard time slowing down. So trying to find the middle slower pace for the longer runs and pacing herself throughout the full marathon.
Okay, well, first off, that's great that you have the energy and the ability to just pick up the pace and keep going. But just know you don't want to exhaust your body too much. The easy days are meant to be easy. And you want to be really aware of that, because on your workout days, if you are incorporating speed workouts, or maybe you're doing tempo runs, or you're doing marathon paced runs, you want your legs to feel fresh and ready to go for those. So that means those easy runs are your recovery, active recovery days, where you are running at a slower, easy pace, so you're not exhausting yourself for those workout days. So I would say just be, really aware of the pace you're running. If you see on your watch you're going a little too fast, just back it off a little bit, even if you don't like it, because it'll be worth it when it gets to your workout days or your long run days where your legs are feeling a little more fresh.
I
Heart
often
rate
find
training.
too,
Go ahead.
sorry, I was just going to say, if you're having a hard time, that might be the day you find a friend that is a little bit more of a slow runner with you, and take the opportunity to go with them on those days, because that naturally will help you pull back.
Good advice.
I was just going to say, heart rate training is a great way to kind of keep you slow. And it's actually very beneficial to have some days where you're actually running slower than you think you should, or even that you want to. And just having a heart rate monitor, you can get a relatively cheap one now that you can try to really stick to that and just keep checking it during your run, try and maintain that lower heart rate, which you'll benefit a lot from in your training. You don't always want to run fast. You don't always want to run even at a regular pace. You want to fluctuate that through your training program, and a heart rate monitor is a great way to do that.
And you're still building fitness when you are doing those slower, easy runs. Like as you're building mileage up, even looking at professional runners and elites, the bulk of their mileage is at an easy pace. That's how you build up mileage, by throwing in more of those easy runs. And even though you might think like, oh, I'm running slow, how am I going to run my race fast? That's not how it works. It's actually still helping you on those easy days.
Thank you. So previously we talked about losing weight during your training and fueling your body the right way. Some people may sign up for a 10K, the half marathon, and have it as a fitness goal. So we have a question that came in: if you're overweight, is it still bad to lose weight during that training? And obviously during the process of this, if the goal is to possibly get into better shape and become healthier?
No, I think that that's a really, really good goal. If your goal is to lose weight, then you're just looking at the balance of food that you're taking in and making sure that you're balanced with your training. But if you're overweight and you're increasing your exercise, and it really depends on why you're overweight. If you're overweight because you're eating a ton of more calories than you're spending, you're probably going to start losing weight just by increasing your exercise and not changing it. So if your goal is to lose weight by running a marathon or a half marathon or a 10K, it would be most ideal to be working with a nutritionist to make sure you're not just cutting the wrong things or cutting too low. But certainly increasing exercise is a great way to lose weight.
All right, another question probably for you, Dr. Goldberg, is do you have any suggestions for those of us who have significant arthritis? Is there anything that might lengthen or improve their running lifetimes?
Well, I am newly arthritic, so I would like to learn all the answers for that. I have a totally different opinion now that I am arthritic versus before, but I do think that a lot of people feel like a lot of people have been told that they shouldn't run if they have arthritis. And I think it probably depends on your age. Certainly people that are in their mid 50s, or I don't know, I'm 50 and older, at some point we're going to need knee replacements or hip replacements. And it's really a balance of activity and staying fit and healthy and at a healthy weight versus how much damage are you doing on your joints. Definitely by increasing the load on an arthritic joint, you're going to have probably more pain, a little bit more inflammation. And as long as you're not limping while you're running or it's not getting worse, I think it's great and fine to do that. But I definitely would make sure that you're doing strength training, range of motion training, cross training with things. Running every day is probably not the best thing to do on an arthritic joint. And certainly if your knee or joint is swollen and warm, you shouldn't be training on that. In terms of supplements, there's some research about glucosamine, fatty acid. Oh my gosh, I just spaced on the thing, but there's not a lot of research on supplements. Glucosamine has kind of been the most championed one and most studied one. But other than that, it's really just about maintaining healthy body weight, strong quads, strong hip muscles, and cross training. And
I often-
potentially maybe a more supportive shoe.
I often will have patients who, they're a runner, they've always been a runner, they want to continue doing it, but now they have this pain, they may have developed arthritis or something. And so they don't want to give it up. So I'm not going to tell them, okay, give up something that you love, that you've done your whole life and you want to continue doing. You have arthritis, give it up, deal with it. I never want to tell someone that, but we can be smart in kind of how we modify things. So changing your goals, even if you are a marathoner, maybe cut down to a half marathon. If you're a half marathoner, maybe start doing 10Ks and really kind of change your goal of like, okay, I'm going to really get competitive with my previous times at 10K, and that's going to be my new race. And just modifying training. So cutting back on maybe the mileage that you used to do, doing more cross training to balance it out, but still allows you to run, still allows you to do what you would want to continue having that same lifestyle, but just modifying that, being a little bit smarter and being creative in how you can kind of do this similar but modified training to reach goals.
For me, I found it really helpful to incorporate weight training. And so instead of just, usually I get up, I just get up and go for a run, and I can't do that every day anymore. So I do have to be more purposeful in my planning my workouts so that I can stay fit and active, and I can still go out and run 8 miles and not think about it because I'm running enough times, but I'm just not doing as much overall mileage. And I think that's a good way to approach it.
We have another question about fuel and recovery after a race and what to eat. So this question from Catherine: in addition to eating enough, do you have any advice on what to do immediately after the race and for the rest of the day in order to support recovery? And then I'm going to add on to that, specifically for Dr. Goldberg, we talked about nutritionists. What's the best way to find a nutritionist? So they start with a sports medicine specialist like you, their primary care doctor. There's a lot of nutrition options out there. What's the best way to make sure that you're in the right hands in terms of finding a nutritionist? So one, what should they eat right after the race? To touch on nutrition.
So I'll answer the nutrition thing first. Getting a sports dietitian or nutritionist is really important because they have a different approach to it. It's not that most people can't answer the questions. I just think can help you with more specific goals. So at UH, we have several sports medicine nutritionists. And then also if you go through, if you just do a internet search, you can look up and look at people's qualifications. But I think that's probably the most important thing, is that they have specific training in sports nutrition to be able to address the questions that you have. And then in terms of food, it is really important to think about what stage your body's in. So post-exercise, you're in a recovery stage. So you really want to make sure you eat within that short period of time. And then throughout the day, you just want to space your meals out so that you have your percentage of fat and percentage of protein and carbohydrates that are spread out. And a lot of times it's best to have your carbohydrates early in the morning and your protein a little bit later in the day. Again, just because you're sleeping all night and that's a recovery phase. So it's really good to have a higher protein percentage at night while you're healing, and then your carbohydrates while you're being active throughout the day. And then fat should be spread out throughout the day, as well as your fluid intakes.
As far as recovery, also just really starts beforehand by having, like we've already mentioned several times, but the right nutrition during and throughout the race. But then, like Dr. Goldberg said, you want to get the protein and carbohydrates in within ideally the first half hour of finishing the workout or the race, and also replacing fluids within the first 2 hours. You can, for longer events, you could use body weight as a guide. So you could weigh yourself before and after, and then really try to get it's like 16 to 20 ounces per pound of body weight lost within that first 2 hours. So it is drinking quite a bit, especially on hotter training days where if you sweat quite a bit, you do want to replenish that early on.
And do know that the finish line chute at the end of the race, they have a lot. They have bottles of water, they have bananas, they have energy bars for you. I think they might even have protein shakes. Don't quote me on that. If there's a specific kind that you like, you know, have it in your car so you can have it as soon as you get to your car. But there's a lot of food available when you get to that finish line for you to refuel and start recovering.
Sarah, did you have a celebratory meal after your races? Do you have something typical that you usually eat to recover?
I really like pizza, so usually pizza ends up being part of the meal with salad. I crave, and I know probably not everybody is like this, but the 2 days before I run a marathon, very carb heavy my meals and not as many vegetables as I usually eat just because of what I end up eating. I still eat some vegetables, but just not as many. So I feel like after the race, I'm really craving pizza and salad. Like there has to be a salad involved. Yeah. And beer.
And when you talk about getting it to the end of the race, there's always the big chocolate milk trucks. Is that still considered the ideal recovery for after a workout and after races?
Well, I think that they've done a great job marketing, and it just comes down to the type of sugar that you're getting into your body. But it does have protein, it does have carbohydrates, and so it's not bad. It's just probably not as good as the marketing is.
All right, question for Sarah. Do you have an opinion on a run walk strategy?
A run walk strategy. So I guess building up your mileage by putting walking in. Is there anything else to that question, or
There's
just
not, or possibly taking a break in the middle of the run. Should you start walking, or does that kind of put you back at a certain point, or do you try to keep running as long as you can?
I would say if you are going for runs and you're reaching the point where maybe you need to stop and walk often, maybe back off on your pace. It doesn't necessarily hurt you to walk, but think about race day, how you do want to make sure that you are running the entire race. Maybe you're training at too quick of a pace where you're tiring out faster. So I would say try backing off your pace and see if your runs become a little bit easier where you don't have to walk, but also don't be hard on yourself if you do need to stop and walk, especially right now. The heat and humidity I know is getting to a lot of people where running is a little tougher, workouts are a little more tough to complete. And so they are backing off on paces, and that is okay. So pay attention to your body and see what you're capable of doing in terms of the weather, and also see if backing off the pace helps a little bit.
Is there a point with the heat and humidity that's going on right now that you revert to an indoor treadmill? And I know typically when people are training through the winter, if there's, snowy days in January and February, should you kind of keep pushing through the weather that's happening right now and go inside, or do you split it up? Do you kind of do both right now?
I can answer that, I guess.
Okay.
I think splitting it up is good. You definitely want to train as much as you can in the type of environment that you think you're going to be running in. And also when you're running in really high humidity, it doesn't even have to be that hot. It puts a much heavier load on your system. And so you're at risk of getting heat exhaustion or heat stroke. So definitely if it's hot and humid out, you need to back off your pace, maybe shorten your run, and listen to your body.
And try to run at the time of day where it's not as hot. So if you're able to run early in the morning, that's probably the best, or maybe even later in the evening when it's cooled off a bit. On days where it's 90 degrees and humid, running at 2 p.m., probably not the best time. So if it works for your schedule, try to pick those times of day where it's not going to be as oppressive in terms of the heat.
And if your race is scheduled to be in somewhere that's hot and humid, like if you live in Cleveland and you're doing a Florida marathon, you might really want to take advantage of that. And if kind of conversely to what you're saying, if you're going to run a race in Florida and you live in Cleveland and the race is in January, you want to make sure that you're training inside in a heat controlled environment so you can kind of mimic what that heat will be like when you're down there. So your body gets adjusted. Train like you plan to race.
Dr. Goldberg and Tim, we have an injury specific question here. I'm going to try to do my best to explain it, but we have a 42-year-old marathon runner who runs about 3 to 4 times a week and then a 10-mile run every couple of weeks. They've been having trouble with their toe, and it feels like it's cracking. Needs to crack back in place almost when it hits the ground. And it only happens after about 10 miles. He's not been able to run a marathon in over a year, but his physician thinks it'll just go away with time. Do you have any thoughts about what this is and how to relieve this pain, or should he see a sports medicine specialist?
It's been going on too long.
Okay.
You should see somebody.
Yeah, you can't just necessarily wait for something to go away. It clearly hasn't at this point. There are a few different things that it could be. It's kind of too hard to answer specifically, but it'd be worth getting evaluated at this point.
Right, and I think we've addressed this. I think we'll kind of expect the answer on this one, but I want to make sure to ask the question. This runner has been swimming and biking for a number of years and has good cardio, and the question is, can you run a full marathon even though they have not trained sufficient training? The goal is just to finish, not hitting a certain finishing time goal. But without training, running wise, is it a smart idea to run a full marathon?
So the can is you probably can. The smart idea is it is not a smart idea. Anytime you change the load on your body, whether it's going from no exercise to a lot of exercise or low impact activity to a high impact activity, you are changing that load on your muscles and bone, and you really are at increased risk of injury.
Yeah, there's something called the specificity principle. And just because you can train, and even if you do long bikes for 4 hours, it doesn't mean you can run that long. So the muscles are kind of operating very differently. Yeah, the weight bearing load and the demand on the muscles is very different, and your energy utilization is going to be different. So I think having a blend of that, and you can do a lot of cycling and swimming during the training, but you're definitely going to have to work in some long runs before trying to do something like that. It's going to make for, I think, a pretty rough day if you don't do much running and then try to jump into a marathon with training with the other disciplines.
I'm going to stick with Tim and Dr. Goldberg on this next question and how University Hospital Sports Medicine is involved in the race. Both of you guys have had many years of experience with covering the race. Can you explain our approach in providing care at the race? Tim, I know you're on a bike. Dr. Goldberg, you might be in the main medical tent and a tent along the way. Can you explain our approach to medical care, and if you do need us along the way, how to access the care?
Go ahead, Tim.
Yeah, so I have to say, having done a number of different kinds of races myself over time, I've never done any event that has as much medical coverage as the marathon and triathlons that UH has sponsored has provided. So we do have aid stations every couple of miles along the course. Usually it's right after the aid station with the water and everything. We'll have a first aid station. So there are physicians and EMTs and athletic trainers at all those stations. And then we have typically 3 teams of people on bikes throughout the course, kind of roaming back and forth to identify people that are struggling or have any issues along the way. And then we're equipped with all kinds of gear, including AED, but also walkie-talkie, so we can get help there immediately if we need it. So we are very visible. You should be able to find someone very quickly. And if you're struggling or having a tough day, kind of going back to the bonking question, if you're not feeling great, you should just stop and talk to one of the medical professionals along the way and explain how you're feeling. Don't wait until you're at that point of, when you're bonking and just done. A lot of factors like we've already talked about between weather and different things that can affect your day. So if you're just not feeling it, we have plenty of exposure along the way to just touch base with someone and get it checked out first.
Thank you. The one thing we've talked a lot about fuel. Is there just a general guideline for hydration that we can touch on? Hydration prior to the race, during, and then obviously after. Can we go over the general guidelines of what to follow in terms of how athletes should be hydrating themselves to prepare for this?
Yeah, so typically it does start early. I would say, like we talked about the meal 2 to 3 hours in advance. You'll want to have basically like a bottle of water. If you think about 20 ounces of fluid, a good couple hours before the race, and maybe another 7 to 10 ounces about a half hour before the race, and then throughout. So every 15 to 20 minutes, taking in like 4 to 8 ounces. So one of those little cups along the race. You want to do that at regular intervals, multiple times an hour. So probably if you could do 3 rest stops or 3 aid stations where you stop and grab a drink along the way, that should be enough to sustain you. Some people require more than others, depending on just their sweat rate. Some people sweat a ton, and other people just don't as much. So if you kind of know kind of your needs based on how you do throughout your training, and then like we talked about, getting a lot of fluid in within those first couple hours after the race to replace everything that you have sweated out along there. So it's about 16 to 20 ounces per pound of body weight lost. If you can utilize that, then you'll really know that you're getting enough back in.
A couple other things too, leading into the race, you want to make sure that you're what we call euhydrated, or basically at balance. So making sure that your urine is light colored. You don't want it to be a dark color yellow. And so that tells you you're hydrated coming into the day of the race. And then also making sure that especially if you're on the race course for over 4 hours, you want to make sure that you're having some carbohydrates in with your water, so that you don't just oversaturate your system. When we sweat, we lose sodium. And then if you just drink in water, you're not taking in any electrolytes. So mix in an electrolyte drink here and there, and make sure whether it's through your drink or through foods sources, that you're getting some electrolytes in there. Especially for those, the question before about cramping, sometimes people are cramping, they're just not having enough salt intake.
Sarah, did you have a certain routine while training? Did you run with a water bottle? Did you run with the goos as you were training to keep yourself hydrated?
Yes, definitely. Depending on the length of my run, I would take gels with me, and sometimes I had a handheld water bottle. Sometimes I would run a route where I knew there would be water fountains along the route that I took. So I live on the west side, so Bay Village has some public water fountains. So sometimes I would revolve my long runs around where those water fountains are, so I knew I could stop when I needed to. But definitely took gels with me, usually 2 of them, depending on how far I was going, tuck them in a pocket or somewhere, so I had them on me to make sure that I stayed hydrated and also fueled during my runs. Even if the weather is cold, as you're doing long runs, or if it's during the marathon or the half marathon, still make sure you're drinking water. I know sometimes your body might trick you into thinking you don't need as much water because it's cold outside, but you do still sweat when it's cold and you're running, and you need to replace those fluids, even if you don't feel as thirsty as you do on a really hot and humid day.
Thank you. All right, we are wrapping up with our questions as they are coming in. We have a few thank you notes from people saying thank you for answering so many questions in such detail. So we appreciate all the pieces of advice and guidance here. Is there anything else that the 3 of you would want to wrap up with as we start to wind down, or pieces of advice as people are getting ready for this October marathon?
I do. I would say make sure you're incorporating hills into your training runs. Maybe do some hill workouts over the next couple of months to prepare yourself for the race. It's not as flat as the previous course. So just if you go to the metro parks, I know on the west side there's that Rock Cliff Hill, or if you live south side, go to Hinckley. Anybody from the east side, are they from the east side to recommend hills over there you could run? Find a hill to do a hill workout, maybe 8 to 10 of those, run up, run back down, or, for your long run, find somewhere that's not completely flat, just to get your body used to running hills, and to mentally prepare yourself for parts of the course that aren't completely flat for Cleveland.
The east side has a lot more hills than the west side does.
Yes, west side's very flat.
I'd say the only other thing that we didn't touch on today yet that sometimes we'll have questions about is tapering. So definitely leading up to the race, at a minimum of 10 days before the race, you really want to cut back on your running volume just to allow the muscles to recover, your body to heal up from all the heavy training that you've done over the months leading up to it. So you want to cut down volume, like I said, but not necessarily frequency or intensity. So you still want to run the same number of days, still work in maybe a little bit of speed work or intervals, but just cutting back on that mileage to allow you to recover. The more fit or the longer or bigger base you have of running, you could do a longer taper, 2 weeks, maybe 2.5 weeks. If you're basically still kind of working your way up to that and feel like you need every little bit of training that you can, I would go right up to that maybe 10-day mark and then taper down from there. So that is important, just to feel fresh and kind of have as much recovery as you can before race day.
Mhm.
We did have a couple east side locations come in, Squires Castle, Chapin Forest. So there are some good metro parks on that side that people are recommending.
Okay, perfect. And just know, I'm not talking gigantic hills on this course. It just rolls more than the previous one. So if you're only training on flat surfaces, then it might be a little shock to your system and a shock to your mind when you run the marathon or the half in October. So it's just good to get in some practice with that.
Well, thank you all very much again for this wonderful advice. If there are any questions regarding the marathon, the registration, or a course, you can email info@clevelandmarathon.com. Again, that's info@clevelandmarathon.com. Thank you again for joining us for the Union Home Mortgage Cleveland Marathon UH Sports Medicine webinar. If you would like to make an appointment with one of our sports medicine specialists, you can call 216-983-PLAY, or you can also make an appointment and learn more by visiting uhsports.org. Good luck to everybody as they run the race, and thank you again for participating.
Thank you.
Thank you.
Thanks. Bye.